Hi, everyone. So today I really want to talk about how Hara diagnosis is far superior to your tongue and your pulse diagnosis in both TCM, Japanese, and Chinese classical styles. And more than likely Korean, but I don't practice Korean, so I don't want to comment there. Um, so the reason why Hara diagnosis was developed and how it is different from pulse and tongue diagnosis. So let's start there, and then we're going to talk a little bit about how Hara diagnosis is superior to the tongue and the pulse, and then we're going to start talking about how you can start developing your Hara diagnosis, and then how you can actually apply it to your acupuncture and your moxibustion treatment, or to your herbal medicine using books like this big bad boy. So first off, let's start about how Hara diagnosis developed. So Hara diagnosis began in Japan, is the physical palpation of the chest and the stomach, usually of the chest cavity, the whole torso cavity actually. It can include both the arms and the legs, but I would say on average, Hara diagnosis usually encompasses either just the stomach or the chest and the stomach. The style I practice has both included, so it just depends on your style and the lineage from which you're taking from. Okay, so Hara diagnosis developed because although while in China, with practitioners like the guy who wrote this book, you were not able to actually touch the client over and above touching their wrist. It was just socially unacceptable. And that's to the point where females like myself, if like I had a stomach ache, I would actually have to point to like a ceramic mannequin on the cupboard table, and I would have to do it very vaguely. Like it wasn't acceptable to be very exact, or for a male to know anything about a female's body, to touch the body. So diagnostics was really simplistic in that what they could touch on the wrist or what they could see in the tongue. Hence, the tongue and the pulse being so intrinsical in TCM and Chinese medicine. So, in Japan, the big difference here is yes, they could take the pulse, but most Japanese acupuncturists and moxibustion therapists and shiatsu massage therapists, they were actually blind. So those jobs were really the jobs of the blind, and that's because they had better senses with their hands, and also they were able to go into the harems of the big samurai and daimyo, and they were able to treat these women without seeing them. So it was really easy to have the blind people take up these practices, and that lineage really goes on for hundreds of years in Japan, of people being the main acupuncturists. And because of that, the tongue diagnosis, although there is some transcription of tongue diagnosis into Japanese medicine, it didn't really get the same priority as in Chinese medicine, because obviously blind people cannot look at the tongue, right? They can't see the tongue. Now, saying that, what they were able to do and what they were uniquely able to do is to palpate with efficiency and unique capabilities of actually feeling what was happening in the body. And that's where Hara diagnosis, against this palpation and diagnostic system of really the chest and the stomach, came into play. Now, uniquely, the Japanese acupuncturists took books like the Shanghanlun and other Chinese classics, and they were very uniquely able to add in specific diagnostics in the Hara diagnosis that matched up to specific formulas. So, for example, for Kyokyo Kuman, which is having tension right here in the diaphragm, having this tension right here would be a very specific formula. That would be a Chai Hu formula, right? If you had ropiness along a specific part in the abdomen, that would be a specific formula. And so that was developed, and it was really in addition to what the Chinese were doing, but also on a completely different track to what the Chinese were doing. And so that's a little bit of the history behind this, and why it's not really taught in TCM schools is, well, there's not a lot of Japanese style practitioners in TCM schools to teach it. So saying that, let's talk a little bit about where you can learn more about Hara diagnosis and the teachers you can seek out. So of course, you can learn Hara diagnosis with me in ShinKyu University. It is one of the founding principles of Japanese medicine. It's something that I teach more in hands-on skills, but I do talk about a lot in our online program as well. So you can definitely come to me for ShinKyu University for that. You can also go to other practitioners like Nigel Dawes, who I think is an amazing compo practitioner. So that's another source of information for you to take this Hara diagnosis to a next level. So there's a lot of different lineages of Hara diagnosis. So rather than getting into a specific pattern in which you should do this, I'll try to give you a specific one. Well, I'll try to give you a generalized one here in a minute. Let's first talk about how it's actually better and will give you better diagnostic results than your tongue or your pulse diagnosis. So when you take the pulse, it changes when the patient comes up the stairs, when they're running in, when they're on medication, when they sneeze. Like the pulse changes so frequently and with such intensity that it can be really, really inaccurate unless you have the patient laying on the table for 20 minutes. So, practitioners in Japan who do rely on the pulse diagnosis more heavily for their diagnostic technique, they usually have the patient come in and lie down for like 10 minutes before they even will see them because they want that pulse to settle so it has a more uniformity to it rather than having, like running in or rushing or, whatever you're doing affecting the pulse. Now, with the tongue, it can be really easily influenced as well, right? So, with the tongue, if you drink coffee, if you brush your tongue, all of these things can really affect the tongue. And also, blood pressure medications are going to affect the pulse, of course, and they're going to affect the tongue. Any type of blood thinner in the body, the biologics really, really affect the tongue. And it just makes your diagnostics not as accurate. Now, what is not as affected by the medicine is, of course, the chest and Hara palpation. So that's why it's more superior. So in Japanese medicine, they often say, check the pulse, check the tongue, then do your Hara palpation. And if all three of those have the same diagnostic results, excellent. That's what you should be doing. Stay on that track. However, if they're all three different, then you should believe in the Hara diagnosis. The Hara is always queen. She never, ever lies, is the saying. So with saying that, let's talk about how you can start implementing the Hara diagnosis into your treatment. And then finally, I'll end with giving you a few suggestions on some books that you might be able to pick up to just start to read into this, and so to pique your interest a little bit. Okay, so for this, I'm going to stand up just a little bit, so I'll be out of frame. I apologize. So that way I can show you a little bit of the order of how you want to start your practice. So the very first thing is there's two different levels of Hara diagnostics. There is a superficial level, and then there is a deep level. You always want to start with superficial because ideally you're feeling on the skin, you're listening on the skin level, and you're feeling and listening deeper into the body. However, when you go deeper into the body, that's always for confirmation. So keep that in mind. We're always going to go superficial and then deep. When we're superficial, I want you to notice that, and I've talked about this many times, superficial palpation is the weight of your hand and it does not disrupt the muscle layer. So if I push hard, you can see how my muscle starts to indent. That is no longer superficial palpation. You are now starting to affect the muscle layer and the sinews. So you don't want to start affecting the body. Remember, your diagnostics are for diagnostics, not for treatment. And so that's a really, really important point and something that they really taught us when we were in school. So for the chest, I'm going to give you a very simple palpation to start with. So you're always going to start, if you're a right-handed person, you're going to be on the right-hand side. The right hip to hip is kind of the rule. So if this is the patient, I want the patient's right hip right next to my right hip. Now, if you're a lefty, you're going to switch that and be on the other side of the bed. Now, when I do diagnostics, I'm going to use my right hand or my dominant hand really to do it. So I'm going to show you on myself, but really you would be palpating on your patient. And when you do that, make sure you're standing at a 45-degree angle to your client so you can still have a conversation with them. And so the diagnostics can now be clues to ask the right questions, right? So you don't have to be asking like 70 questions like you would normally do in a TCM intake clinic at school. You can ask maybe 10 questions and have them be very poignant questions to get to the answer that you want, or not even want, to get to the answer you need, I should say. So we're going to start with the chest. We're going to only do the weight of our hand, and we're going to start, if you can see, here's my clavicle, always below the clavicle. Never go above the clavicle because that's very suffocating, and this doesn't feel good to anybody. So we're going to start below the clavicle, and we're going to do position 1. Here I can listen both to the left and right of the chest if I have my thumb open, right? And I can also feel for tension in, for example, the chest muscles and the pectoral muscles. If a woman is on her cycle, you can see if she has breast tenderness. If someone has anxiety, right, you can look for that. So we're not only looking for muscle tension, we're looking for really 5 factors. We're looking for deficiency, excess, cold, heat, and then juki, which is often termed as pernicious chi, a pernicious element, an evil element. It has a few different English translations, but it's really just ki or chi that we don't want in our body. So we're going to start here on this first point, and then we're going to fold our thumb in. It's hard on myself, but we're going to fold your thumb in, and you're going to go in between on this Ren 17 line. And then the third position will, again, hard on myself, but you're going to go kind of Ren 17 will be at the fingertips, and you're going to get the bottom of the sternum. So this section of the sternum. So here you're covering the entire Ren from here to here, and we're also covering the stomach. And if really we're interested, we could also palpate the lung channels as well. Check out the lung mu and all of that kind of stuff. So after we do those, excuse me, those 3 points, we're going to go to the rib cage. We're going to go, just to show you, this is my rib cage right here. This is the bottom of it. So we're going to go on top of the rib cage. Here's again the bottom of my rib cage where this hand is. On top of the rib cage, below the breast, 4, and then 5. And here we're listening for things like how well does the lung expand? Do they take really short breaths? Do they have excess heat? Is there also, you can of course check out the liver mu and all of those things. So, all right, so when we go into the abdomen, I swear I can speak less and less English every day. When we go into the abdomen, we're going to be doing the same thing, but at a superficial level. So I am going to make one quick note here. When we are on the chest, it's very rare that we do a deep palpation. Usually on the chest, it's quite superficial unless you want to really point something out to the client. So for example, if I wanted to point out to the client that after I checked their chest and then their belly, and I'll show you the belly abdomen palpation, the Hara palpation here in a minute. And for example, if I feel ropiness here on the side, sometimes I want to check and see if that ropiness continues up the stomach channel, right? And so you can do a little bit of extra palpation to either prove it to yourself or to prove it to the client, to be like, yeah, you actually have ropiness and it goes up here to the back of your neck, right? And so when I go down into the abdomen, again, starting first with my superficial, it's going to be very difficult because it's my own stomach, but I'm going to have my hand ideally vertical, and we're going to start either here in the center, or you can start on the sides. Now, that depends really on the style that you're practicing. I like to start on the side. So we're going to go underneath the rib cage, 1, 2, and then we're going to go into the center, covering the belly button, really this Ren 12 to Ren 4-ish area, depending on the size of your hand. 4, and then you're going to go below the belly button, 5, and then you're going to go on each side of the stomach. So, and then you're going to check here on the sides. You can also check the daimai, the gallbladder channel. If you want, you could even reach around and check the bladder meridian and see if there's any tension along the sinews back there as well, to see if they have back pain. So there's a lot of information that you can glean here. Of course, we have kyokyokuman, which I mentioned initially, which is this tension of the diaphragm here, which I would say in TCM is kind of like a liver excess pattern, but it's really a Chai-Hu formula, indicating of Chai-Hu formula for the most part. And then also here we can see if they have excess in Ren 12 all the way up to the tip of the sternum, which can be really indicative of things called shinkahi or shinkahiko, which means that they have a lot of anxiety usually, or tension. It can also just be that they have stomach ulcers or something physical going on, of course. Definitely if they have ropiness, right? There's a lot of indicators that we can have. Now, when we go into a deeper palpation, you don't have to follow this directly if you're not doing my specific lineage. I do recommend it though. You're going to break it up into several pieces. And so we'll start from the beginning. Okay, we're going to go into the middle. I'm going to use the tip of my fingertips. Make sure you don't have long nails. And I'm going to take my other hand and push it on top. And usually along the center line, I might do a rocking motion horizontally across the abdomen, or I might gently push in, but make sure you're very gentle about this. And also make sure whenever you're palpating that you're rising and falling with the chest and the stomach. This is very important to not feel impressive. So we're going to start here. We're going to go 1, 2, breaking up the space in between the tip of my sternum and my belly button into 2 places. And then I'm going to go underneath the rib cage. You can either do this as 1, or you can break it up into 2 places on either side, depending if I'm really interested in a specific point, I might break it up because that's a really big area to do with your hand. So 1, 2, 3, 4. And then I'm going to go to the stomach channel. maybe around the Ren 12 area, 5, and a little bit below the belly button, 6. These are for blood stasis and then also ropiness. There's several different diagnoses that you can get here, and I'll do the other side. And then, of course, the belly button would be the next. And then you, of course, can go back and really palpate the sides here to, again, get the bladder, the gallbladder and the dimi, and if you reach behind, even the bladder. So that's a very simple, quick run through of a gentle Hara diagnosis that you can do. Now let's talk about how you can start implementing it into your acupuncture moxibustion and how it can start to change things. So there is a little bit of study that you're going to have to do in order to figure out what your finding is actually what that means. But really, when you're starting out, you can do something as simple as treat what you find, right? So if we find excess at Ren 12, you can do a dispersive technique. So for me, that would be insert quickly, take out slowly, or you can do something as simple as quick, shallow, and many, right? That's a very stereotypical dispersive technique. And if you find cold or deficiency at Ren 4, you can just do a tonifying needle technique or a moxa technique down at Ren 4. If you're finding gas in the abdomen, which is a different technique I didn't show you, you can, of course, help the GI tract move to get the gas out, right? If you're finding ropiness that comes up to the back of the neck, but that's rooted actually to the left or the right of the lower belly button area, then you need to think about, like, perhaps this neck tension is actually stemming from blood stasis in the abdomen, which is what usually that area is indicative of, doesn't have to be. Or is there a different reason why this is happening? Is it actually rooted in the deficiency that's below the abdomen? And so now with your research and a little bit of teaching and guidance, hopefully from someone like myself, or some other practitioners I'll mention here in a minute, you can start to really develop your Hara diagnosis to be specific and hands-on. So one final note I want to say about your Hara diagnosis is that sometimes you can do techniques to change the Hara immediately, and some things take a lot more longer. So there's a lot of Kiko Matsumoto styles of Hara diagnosis where you can do a specific point and it makes the Hara diagnosis go away right away. And other things take a lot longer. For example, blood stasis is going to take a lot longer. So just be really gentle with yourself in your learning of this material because it takes a lifetime, really. So let's talk about how you can continue to learn it, some books that you can resource, and some people you can resource. So of course, you can come to me to learn Hara diagnosis. It's something that we learn not only within the online platform, but also something that I learn and everyone else learns as a group and community through studying the Shanghanlun, not this specific text, actually the Japanese text, and resourcing other texts and English texts and comparing them line by line of the Shanghanlun. We do that monthly within ShinKyu University. It's a free part of the entire platform and the membership. So I highly suggest joining that program. I also go through it, of course, in all of my live workshops. So if you're interested in that, you can definitely comment below that you would like to participate in one of those or you'd like to be in ShinKyu University. I'd love to have you. Other people that do Shanghanlun and also Kampo herbal diagnosis and Hara diagnosis is, of course, going to be Nigel Dawes. He's a great teacher that I highly suggest you checking out at some point. A little bit more towards the Kampo medicine, so the herbal medicines, and less towards the acupuncture and the moxibustion. So just keep that in mind. And then I've also heard that Kiko Matsumoto sensei does do some Hara diagnosis. I've never studied with her directly, so I don't know the amount of knowledge she really puts forth and all of those kinds of things. So that's something you'll have to research. So let's talk about some books of knowledge that I would love for you to check out in order to really research this Hara diagnosis and how you can utilize it. So definitely any books that are written by Nigel Dawes are really, really good on Kampo herbal medicine. Also, Dr. Butch Levy, another great person that has written some really simplistic and easy to understand books about Kampo herbal medicine and Hara diagnosis. Great books to start your learning at and to start getting an understanding of kind of the complexity, but also the simplicity that you can gain from having such a powerful diagnostic tool in your clinic at the bedside every single day, and something that you can use your hands to do, which is beautiful. All it costs is your time, energy, and effort to study the material. So other books, of course, that you can learn are this big bad boy. I actually don't recommend this particular work of knowledge. There is another English translation that I recommend more. If you're interested in which one I recommend, I definitely will let you know. Just put it in the comments below and I'll put a whole bibliography for that recommendation. This book is good. The only thing I don't like about it is that the commentary isn't as good as the other book that I would recommend for you in English. And also it takes the Shanghanlun and takes it out of order of the traditional classical order and puts it into the modern order. And I find that very confusing personally, because the Japanese are very much traditionalists. And so when I'm studying my teacher's book, Yokota Kampu Sensei's discussions on the Shanghanlun, it's very confusing to come to this English translation and have it be all out of order. Of course, if you can read Japanese, I highly suggest this book. It is absolutely, fundamentally, life-changing, amazing. It is awesome. I am translating this book for members of the ShinKyu University line by line, chapter by chapter. So I highly suggest that you join ShinKyu University, get that knowledge. Some of the information, and I'm just going to show you because I can't do a screen share with the live. Some of the things that are really interesting about this particular book of knowledge is that it's going to take formulas like this is Guizhi tongue, and it's going to start really helping you to understand why there is an upward flow of qi, why there's an upward flow of rising qi in the body. Why is it rooted in deficiency? Why do we have a floating moderate pulse? Why do we have sweating, and what else? I'm not thinking right now. We have sweating, aversion to wind, fever, and usually headache in the Guizhi tongue formula. And how is that different than, I'm going to pick one randomly here. I apologize. I don't know the English translation to this one right off the top of my head. How is that different from this formula that also looks to have an upward flow of qi and deficiency, but also has agitation and vexation in the chest? How is it different from this formula? And it really does go through line by line and discuss it. So if you can read Japanese, you got to get this book. It's really, really good. However, if you cannot read Japanese, you got to join ShinKyu University and study it with me because it's amazing. Again, there are a lot of lines in the Shanghanlun, and so it will take me a while. Eventually, I will hopefully publish a translated version of this book of knowledge. But until then, you get to study it with me, hopefully. So that's how Hara diagnosis is so much better than your pulse and tongue. Again, it doesn't change with medicine. It doesn't change on the fly like the pulse. It's not as affected by medications and coffee and brushing your tongue and things like that. It's just a standard that stays true and is always, always correct. So I really highly suggest that you take books like the Shanghanlun and teachers like myself, Nigel Dawes, Dr. Butch Levy, and others really into your practice and start to develop your Hara diagnosis, because it can be super powerful. And really, again, all it takes to study Hara diagnosis are having some hands that are willing to work and some patients that are willing to get treated and some time, energy, and effort put into actually studying the material and really understanding the material. So if you're with me, go ahead and head over to ShinKyu University and check out the program, or you can comment below that I want in and I will message you back to get an interview set up. Thank you so much for joining me today on this live, all about how Hara diagnosis is so superior to your tongue and pulse. And yes, I am egotistical about that. And then for next time, for next week, I'm just looking at my list, we're going to be talking about how Japanese acupuncture and Japanese styles developed. I'm going to take a little bit of time to talk about how Iyashi no Michi, which is the style I absolutely love, developed. We're going to be talking about that next Wednesday on the live. Again, that's usually somewhere between 4 and 6 p.m. Mountain Standard. It just depends on when I'm done with clinic for the day. So hit me up then. And I thank you so much for your time today. It was great studying with you. All right. See you all later.